Hello and welcome to Real Biz. I'm Rebecca Jarvis here in New York City, and here's what's on our radar today. Fashion Week just wrapped up in New York City, and now the big designers are headed to London. But before they get out of town, we have some of the highlights of this year's event, from those painted jeans making a comeback to the best makeup trends on the runway and facelifts. Yes, that is right, facelifts. New York City's top surgeon has real patients from 33 different countries walking the runway to show off their cosmetic surgeries, and we're going to tell you more about that in just a minute. All right, and we want to turn now to those not just designer clothes and makeup making the headlines, but also one of the unique things at the shows took place during Fashion Week, combined art, fashion, and plastic surgery for the very first time ever. Real cosmetic patients from 33 different countries strutting their sculpted, fashion-forward faces down the runway. That's what you're looking at right there. And I want to bring in the man behind it all. He is Dr. Kassir, triple board certified New York City facial plastic surgeon. It's nice to have you with us.
Thank you for having me.
So I've seen the videos of this, and I'm perplexed. Explain what's going on here.
Okay, so last year, Rebecca, we had a plastic surgery fashion show. This year, we put an art twist on it. We invited all of our patients. We actually got flags from 33 different countries. Those are the countries that were able to show up. There's actually more countries. And the point being was that we had pictures of patients who had operations on the walls, and we wanted to demonstrate to patients and the public that plastic surgery isn't just surgery that you should be afraid of and worry about. It's art in the sense of your left brain, which thinks about mathematics, which is the golden ratio. We demonstrated that too. The golden ratio is the divine proportions of what your brain deems as aesthetic, combined with like Baroque beauty. And you combine those together and you get art, so people can come from all these different countries and still look and maintain their ethnicity, but look a lot better.
Right. There's this, is it relatively new, what's known as ethnic rhinoplasty?
That's a big trend.
Explain what that is.
So ethnic rhinoplasty means if someone comes in from the Middle East, from Jordan, Palestine, Iran, Israel, they probably have different needs, different cultural beliefs than somebody from Southeast Asia. For example, somebody Chinese who needs a totally different surgery, and a Chinese person, if their nostrils are too big, money flows out. In the Middle East, you want a nose as small as possible. South America and Central America, a little different, and in the northeast corner of the United States, everybody wants it hush-hush. No one wants to know that anything's been done, and they want a natural look. So you have to get everyone to that nice ratio and also preserve those cultural and ethnic features that are individual to those people.
So what you're saying is don't strip away the identity of the person with the plastic surgery. But I do wonder what message all of this sends to people. As you see nowadays, Groupon is now doing plastic surgery. It's become so much more prevalent than when I was a kid. Do you ever feel any concern about the side effect of that?
You know, we do, Rebecca, and I think our message was, if you're going to do it, at least learn about it, investigate it, and do it correctly. So we eschew Groupon and anything that's trying to commoditize this. This is your face, this is your body, this is your health. You can't negotiate on things like that. That's our position. And as far as you know, how prevalent it is, I mean, you know, people are okay right now getting braces, for example. There's no stigma with that. And so we get emails from teenagers, from adults regularly, Rebecca, that say, Dr. Kassir, my self-esteem is low. I have a job, I have this, but can you help us? And do you think this would help? And then you start a conversation and a relationship and see, is that person the right candidate for you to do anything on? Mm-hmm. And as long as they don't have something, God forbid, body dysmorphic disorder, it's certainly worth having that conversation.
What are the 3 questions every patient should ask?
Who's your doctor and who's your physician? In terms of board certifications and specific expertise. In other words, the trend for ethnic rhinoplasty, it's also a trend for super subspecialization. So I do facial plastic surgery, I do rhinoplasties, I do facelifts, I do injectables, I don't do implants, I don't do. So first of all, find out if the doctor you're going to is a specialist in what you want. Do they do this often? And do they have an accredited place that they're doing it in? Mm-hmm. And in light of the Joan Rivers mishap.
And when it comes to talking to that doctor that you're vetting, is it appropriate to ask them for references and talk to other patients?
Absolutely. Absolutely. I mean, for us, we put everything on display. So not only do we encourage patients to do that, we also had them come to this event and see 300 people that have had things done. Say, go talk to them.
Well, it's so nice to have you with us again, Dr. Kassir. Thank you for joining us.
Thank you so much for having me, Rebecca.
And best wishes. Have a nice weekend.
I appreciate it. Thank you.
Busy one. More
you.
surgeries to do. And thank you for joining us for Real Biz. We want to hear from you. Which fashion designers stood out to you this year? You want to tweet us at Real Biz with RJ. And until next time, this is Rebecca Jarvis from New York. Have a great weekend.